Okay, so the next topic, of course, has physical and rehabilitation medicine as its core. So now PRM is becoming more and more a health strategy of our century. And of course, there are some new trends that are developing for spasticity treatment through multimodal management. And I'm going to highlight this through a case-based study. So PRM's evolution through centuries was also kind of difficult at times. So there were some modifications, and its development included the impact of wars, epidemics, sports, professional and environmental factors, even accidental events, and unfortunately the pandemics. So due to the unknown conditions and shortcomings created by the world spread of the coronavirus, PRM had to continuously adapt. So even if we also used before the telemedicine or telerehabilitation or teleevaluation, we had to adapt really quickly in order to provide the best care for our patients, either in a program, either in the hospital or at home or another rehabilitation-based station, let's say. So PRM programs adapt to meet individuals' long-term necessities and also optimize the effects. So through multimodal strategies and global approaches. So as we all know, our specialty is one of a kind. It's very different from other specialties, and it encompasses a global approach of each individual. Its core is revolving across the international classification of functioning, disability, and health. Of course, additionally, it considers comorbidities and adapts the rehabilitation program for better outcomes. It also gives the opportunity to target the better therapy and the rehabilitative plan for each individual. So basically, the ICF creates the same language for its specialists, and it is way more simple to adapt this way. So rehabilitation is most commonly described as a process that starts at the diagnosis and continues as long as an individual needs. So this process is comprised by 4 steps: assessment, goal setting, interventions, and outcome measurement. So, of course, we all know, even according to the World Stroke Organization Global Stroke Fact Sheet from 2022 and the update in 2024, that for the acute stroke, it's very important to act rapidly. As our neurologist colleagues say, time is brain, well, also time is spasticity. So we have to adapt really quickly and intervene with early initiation of the rehabilitative program. Also, optimizing the effects of treatments through multimodal strategies, and also considering functioning along mortality and morbidity is positioning rehabilitation as a main health strategy of our century, with a number which is increasing, including novel therapies and interventions, notably for stroke survivors. So while understanding spasticity can be complicated due to its complex and multifaceted nature, it also involves both neural and non-neural components. So it's important to see spasticity not only globally, but also on its defining parts. So the management should be provided within a comprehensive, individual-centered rehabilitation program, also to set active outcomes for specific spasticity interventions and therapies, and of course, to initiate early post-stroke these therapies. So facing non-attained treatment outcomes or adjunctive therapy and multimodal approach, of course, should be considered. So the addition of a second either pharmacologic or non-pharmacologic treatment to optimize the effectiveness of the initial used therapy, such as adding either radial extracorporeal shockwave therapy or, I don't know, electrical stimulation or casting or splitting, leads to an improved outcome. So this is considered basically an adjunctive therapy. Also, it is very important to define what is the adjunctive therapy, what is the multimodal therapy, because sometimes they are used interchangeably, but they don't mean the same thing. So the adjunctive therapy is very time-specific. We take into consideration that we have 2 weeks to add another therapy to the initial therapy in order to enhance it. The multimodal therapy is actually an integrated, individual-centered program, either of pharmacologic or non-pharmacologic strategies, which we apply at the same time, so concurrently, to enhance the treatment's effects in a global manner. So we take into consideration spasticity, but also conditions that are associated to it as well. So through a case-based study, the aim is to highlight the importance of multimodal strategies, which are increasingly supported by scientific research, also for improving patient outcomes and attaining very specific goals for each individual. So PRM trends in spasticity management present the case of a 55-year-old Caucasian male who suffered an ischemic stroke, was impaired by right hemiparesis, both for the upper and the lower limb, but most importantly, its daily life activities were very poorly due to a clonus that interfered with every activity. It also had a score of 3 on the visual analog scale, and he was admitted in the PRM department 15 days after his diagnosis. So the rehabilitation plan included the 4 pillars: the assessment, the goal setting, interventions, of course, and the outcome measurement. So it was important for the goal setting to take into consideration decreasing the spasticity degree, but also clonus and pain, and also to improve balance and gait for this patient. So the interventions actually consisted of oral medication, botulinum toxin injection, application of radial shockwave therapy, and also virtual reality through a stabilometric and gait analysis system, as well as home rehabilitation. Of course, this was all performed during a conventional rehabilitation program. So the core was actually, of course, the physical therapy part and the occupational therapy as well. So outcome measurement, of course, focused on the goal setting. So we used international scales for spasticity, pain, balance, and gait, and we correlated them with data provided by quantitative analysis from those systems. So we used, we can see on the left, we used the radial shockwave therapy to apply on the triceps rear muscle, 2,000 shots, and the patient over there is on the stabilometric system. It was put on the trunk device for the assessment, but as well for the training. So at the follow-up, at 3 months, the stroke survivor showed improved balance, gait, and function, and decreased degree of spasticity and clonus score. What is important to note also is that the pain decreased and its quality of life also improved. It is also important to note that the goal attainment scale was better than expected. So this as well says a lot for this patient to be able to regain his autonomy and maybe, go back to work and have as a normal life as possible. So this case showcases the efficiency of early rehabilitative intervention through multi-therapeutic strategies, but what it's important to note is that all of them were performed early. So the interventions led to overall significant improvements on balance, gait pattern, function, pain, and spasm intensity. And the findings highlight the benefit of early rehabilitative intervention and comprehensive spasticity management to enhance functional outcomes and increase quality of life for these patients. Actually, for these individuals, because we have to take always into consideration the fact that our patient is an individual before being our patient. So thank you for your attention. And this is a road from Romania, Transfăgărășan, but sometimes our road as a physiatrist and the road of our patient and the road of physiatry is sometimes similar. But as you can see, it's both beautiful. So thank you.